Welcome back to Have More Babies. Today we are tackling a topic that causes a lot of confusion for parents. Yeast infections in kids. If you've ever had that rash that just won't quit, or if your toddler is suddenly super fussy for no clear reason, well, trying to figure it out yourself is just frustrating. So our mission today, using guidance from Omega Pediatrics, is really to get you up to speed quickly. We want to clear up the confusion, especially around what symptoms look like in really little kids, and figure out exactly when you need to pick up the phone and call the doctor. We usually think yeast infections. We think adults, right? But the pediatric guide is super clear. Kids definitely get them too, and they show up differently.
Yeah, and what's really interesting is understanding the biology behind it. It helps kind of demystify the whole thing. Yeast, specifically Candida, it's just a type of fungus. It's normally there on our skin, in our mouths, in the gut. It's totally normal. The problem isn't the yeast itself, it's the overgrowth. It happens when that natural balance gets thrown off.
Okay, so balance is the key word here. What are the big things that actually disrupt that balance in a child? It's got to be more than just like not being clean enough, right?
Oh, absolutely. You've basically got two main culprits. Antibiotics and moisture. Antibiotics are probably the biggest trigger. They're great at killing bacteria, obviously, but they don't really distinguish between the bad stuff causing, say, strep throat and the good bacteria that normally keep yeast in check. So once those good bacteria are knocked out, Candida just it sees its chance and goes for it. And the second big factor is diet, specifically too much sugar. Yeast absolutely loves sugar. It's like jet fuel for fungus. So a diet high in those refined sugars can really contribute. And the third one, which the sources really highlight, is just moisture. Simple as that. Not drying properly after a bath, or that one detail that catches parents out. Wearing a wet swimsuit or damp clothes for too long, that creates the perfect warm, damp environment for yeast.
Wow, that wet swimsuit thing. Yeah, every parent needs to file that away, especially with summer coming or after swim class. Okay, so where does this fungus actually set up shop? You said they manifest differently, so it's not always just a straightforward rash.
Exactly. The location really dictates how it looks, and the guide breaks it down into four common areas. First, you often see oral thrush. That's those white kind of creamy patches inside the mouth, on the tongue, cheeks, roof of the mouth. And for parents of babies, the key thing is telling it apart from leftover milk residue. Milk usually wipes off easily. Thrush patches, they tend to cling on. They're harder to scrape away. Then, of course, there's diaper rash. But a yeast diaper rash looks specific. A normal contact rash might just be where the diaper rubs, right? A yeast rash is typically bright red, looks really inflamed, and it has these distinct little red dots or bumps that spread outside the main rash area. People call them satellite lesions.
Okay, satellite lesions, that's the visual cue then. So if you're using regular diaper cream and seeing those little dots creeping outwards, that's a flag for fungus. What about other areas? Not just the diaper zone.
Right. You can also get general skin infections, especially in those warm, moist spots like under the arms or in neck folds. They show up as red, really itchy patches. And yes, the guide does confirm it. While it's less common than bacterial infections, yeast can sometimes play a role in recurring ear infections. That usually points to maybe a more systemic balance issue going on.
Okay, so that brings us to telling things apart. Redness, swelling. I mean, that could be anything with kids. How do parents spot the specific red flags that scream, fungal infection, something burning?
Well, the key is often the level of irritation. It seems sort of out of proportion to how it looks sometimes. A yeast infection often brings this intense itching or burning feeling. And since little kids can't just tell you, hey, this burns, it comes out as sudden fussiness, maybe irritability, constant pulling at that area, or trouble sleeping. If it's oral thrush, that burning can actually make feeding painful, so the baby might refuse the breast or bottle.
And looking specifically at the genital area, vulvovaginal yeast infections. There's a really defining physical symptom there, isn't there? Something that separates it from just general irritation. What's that crucial detail?
Yes, absolutely. You're looking for that distinctive discharge. The sources really emphasize this. If it's a true vaginal yeast infection, you'll likely see a white, thick, often kind of clumpy discharge. It's often described as looking like cottage cheese. It might have a slight yeasty smell like bread, but often it's odorless. That specific look and texture, that's the hallmark.
Right. Now, this is where it gets really interesting, and honestly, where the pediatric guide offers such vital clarity for parents. We need to talk about vulvar irritation in toddlers' kids out of diapers, because it's so often mistaken for a yeast infection.
Right. And the truth is, actual vaginal yeast infections are relatively speaking, pretty rare in young girls who haven't hit puberty yet. The guide explains it's basically down to hormones. Yeast infections tend to need higher estrogen levels to really thrive on the vaginal lining. Prepubescent girls, they have very low estrogen. So the environment just isn't usually right for candida to cause a full-blown infection there.
Yep.
So yeah, if you have a toddler complaining about itching or redness down there, but you're not seeing that classic cottage cheese discharge,
Okay.
the pediatric advice is definitely pause before jumping to the yeast conclusion.
That is such a key point for listeners. Okay, so if it's usually not yeast in a toddler with that kind of redness and itching, what are the more likely culprits we should be thinking about instead?
Well, the vast majority of the time, it's actually irritation or maybe a simple bacterial vaginitis, often linked to hygiene habits. The number one thing to check is wiping technique. Not wiping front to back is the classic way bacteria and moisture get introduced from the back to the front, and that leads straight to irritation and redness. Other big factors are chemical irritants. Think harsh soaps, those fun bubble baths. They can be real culprits, or even scented laundry detergents used on their underwear. And then there's simple mechanical irritation, maybe from clothes that are too tight, or like we said before, just excess moisture hanging around from not drying well or staying in damp clothes.
Wait, okay, so redness and itching could be mild irritation, could be bacterial vaginitis, or much more rarely, yeast. How do we even start to differentiate those before calling the doctor? Like, what's the practical difference between symptoms of a UTI versus what we suspect might be yeast?
That's a really good question because telling them apart is crucial. If it's a urinary tract infection, UTI, the symptoms are usually focused right on urination. Does it hurt when they pee? Do they suddenly need to go all the time? Or maybe accidents after being potty trained. That points towards the urinary tract. If it's bacterial vaginitis, the discharge usually looks different. It might be grayish or yellowish, maybe even greenish, and often it has a distinct kind of foul or fishy odor. A yeast infection, remember, typically has that clumpy white discharge and intense external itching or burning, often without those severe urinary symptoms.
Right. So if there's irritation, but it doesn't really fit that yeast profile, check hygiene first. But when does this cross the line from just, annoying irritation to, okay, need to call the pediatrician?
Yeah, the sources give some really clear guidelines on this. Definitely seek medical advice if the irritation or redness persists for more than a couple of days, even if you've tried improving hygiene. Also, call immediately if there's severe discomfort like constant pain or scratching that's messing with sleep or play. And obviously, watch out for any really concerning, uncommon symptoms, unusual swelling, and any open sores or lesions, or, and this is important, if the symptoms come with a fever. Fever usually signals something more systemic that needs checking out fast.
That checklist is super helpful. Okay, let's shift to the action plan. We suspect something, we've decided it's time to call the doctor. What's the process look like then? It seems like it boils down to three main steps, really emphasizing getting the right diagnosis. Step 1, see a pediatrician, get that professional evaluation. Step 2, get tested. A quick swab or even just a good look can usually confirm if it's yeast, bacteria, or just simple irritation. And then step 3, start treatment, but based on that confirmed diagnosis, you can't just throw any cream at it.
Exactly. And when it is confirmed as yeast, the treatment is usually pretty straightforward with targeted antifungal medication. For skin rashes, diaper rashes, you'll typically get antifungal creams things with nystatin or clotrimazole applied right to the spot. For oral thrush, it's usually a liquid antifungal that the child swishes or swallows. And if the infection is really stubborn or seems more widespread, the pediatrician might go for an oral medication like a pill or liquid to treat the fungus systemically.
And here's a really critical point. It ties back to symptoms getting better quickly versus actually curing the infection, compliance. This is where parents can sometimes slip up.
Oh, absolutely. This might be the single most important practical detail about treatment. Often, the itching and redness start to feel better really fast, maybe within a day or two of starting the cream or medicine. And because the child seems better, it's tempting to stop the treatment. That's a huge mistake. It's so important to finish the entire course of medication exactly as prescribed. Usually that's several days, maybe up to 2 weeks. Stopping early is the number one reason these infections come right back, and it can even contribute to the fungus becoming resistant later on.
Right. Don't just treat until it looks better. Treat until the prescription is done. Got it. Okay, now let's talk prevention. Best defense is a good offense, right? If we know yeast loves moisture and sugar, the strategy has to be about cutting off its fuel supply.
Precisely. And the general prevention tips are really actionable for parents. First, keep skin folds, diaper areas, anywhere prone to moisture, really dry. Pat dry thoroughly after baths, swimming. Second, take a look at diet. Limiting sugar, especially those simple carbs and refined sugars, definitely helps starve out the yeast. And third, be mindful about antibiotics. Always talk with your doctor, is this antibiotic truly necessary, especially for maybe a viral thing. And if it is needed, sometimes doctors might suggest a probiotic alongside it, just to help support those good gut bacteria.
And since we highlighted improper wiping and chemical irritation as huge culprits for toddlers, especially girls, what are the specific, detailed hygiene steps parents should be teaching or implementing?
Yeah, this is all about reinforcement. Parents really need to actively teach and make sure kids are using that proper front-to-back wiping technique every single time. Start early in potty training. It's key to prevent bacteria from the back moving forward. And then removing irritants. Use mild, unscented, pH-neutral soaps or cleansers for washing that area. Avoid harsh chemicals, perfumes, which often means, sadly, saying goodbye to those fun bubble baths.
Oh,
They can cause really significant vulvar irritation in little girls. Clothing matters too. Always opt for 100% cotton underwear. It breathes better. And make sure wet swimsuits or damp clothes come off immediately after they're done swimming or playing.
and there was one more preventative tip the guide mentioned, something about nighttime.
Yes, just promoting airflow. For younger kids, especially if they tend to sweat at night or have occasional accidents, letting them sleep without underwear or pajama bottoms sometimes can really help. It allows for better air circulation. The goal is always creating a cool, dry environment where yeast just doesn't want to grow.
Okay, so wrapping this all up, what's the big takeaway for you, the parent listening to all this?
I think the strongest message we got from the pediatric guidance is really about the danger of self-diagnosing. The sources say it again and again. Always get a confirmed diagnosis from a pediatrician. You need them to figure out the right medication, the right dose, and for how long. You have to know if you're fighting yeast or bacteria or just irritation before